questions from different VCOSS members about questions within the community sector about areas and programs that tend to be underfunded or where demand is increasing dramatically and organisations or sectors are stretched. And we've heard from disability services, disability housing, mental health carers, those providing drug treatment, family violence services. There's quite a wide range of service sectors that are active in our membership. So maybe if we go through a couple of these areas, I might actually start with disability services. Bruce Atherton asks, disability support services in Victoria are underfunded by $70 million a year. Will the Coalition give a firm commitment to rectify underfunding of disability services in the next budget if elected?
And this is something I've been working on with NDS for a long time, and in fact the only reason the PricewaterhouseCoopers review of unit pricing came to light is that we ended up demanding it through the upper house. That was the only reason that the government released it. So not even the sector had the information, even though it was their information provided to the consultants in the first place. So this has been a strong point for us. And I've been very clear with NDS, and I'm very happy to be clear broadly, is in opposition we don't have that detail. We understand the issues, we've been an advocate for the sector in relation to addressing the issues, but we're not in a position to make any commitments in relation to it until we can get in and see what the modelling actually says. What is the detail? How much is it? Is that true? Even as recently as today, the review of day services is being questioned about whether the most basic information is there to make these sort of decisions. So we are totally committed to having a look at this unit pricing, because we can't continue to ask sectors across the board, it's not just disability, it's also drug and alcohol and other areas as well, to keep doing more for less. And we will be having a look at that immediately if we're in a position to in government to appropriately fund the services that these important organisations are delivering.
Thank you. Many caring, this is Marie Bowen, many caring families want better access to housing and support to secure the future of their family member living with mental illness, and as well support for people with disabilities in their families. What would a coalition government do to ensure that people with a mental illness and all people with disabilities have access to the stable housing and ongoing support they need to make community living a reality?
And housing is so far and away the major issue that I hear from carers and families about their loved one who needs that sort of assistance. And that's why we actually initiated the review into support accommodation for people with a mental illness and a disability through the Parliament once again in the upper house, so that we could highlight those issues, so that we could give carers and families and individuals in those situations a voice in the process, and we could really know what the reality is. We've already made commitments through our mental health policy that housing is going to be much more integrally linked. And we haven't talked yet about mental health very much, but in addition to significant investments in community-based care for mental illness, which will mean people can get help earlier and not end up in acute hospital situations, we are committing to piloting a program where we put housing officers along with employment officers and education officers alongside those acute services and community-based services, so that that transition either out of hospital or out of community-based care can happen more effectively into a housing situation. And so you've got advocates alongside people with a mental illness who can help that transition, because too many people are exiting hospital or addressing their mental illness but in unstable housing, which doesn't contribute to their well-being and their recovery. We're also committing to trialling with the Mental Illness Fellowship an innovative pilot about how we utilise the private rental market for people with a mental illness, and wrapping alongside using the Commonwealth Rent Assistance, putting in some additional rent assistance ourselves and wrapping services around that. And the Mental Illness Fellowship will pilot this as a demonstration project over the next 3 years, and we're really excited about being more creative with how we look at the housing issue that is absolutely integral to recovery and that has to be alongside for people with a mental illness. Now, for people with a disability, we will have more to say as well, but we will be putting in more supported accommodation beds. But I think what we say very clearly again is we need a more flexible model. We need some innovation and new ideas in relation to this, not just continuing to build 5-bed CRUs all over the country. It's a very inflexible model that the government has. And it's not what we're hearing that families and carers want. It's not necessarily what the individuals with a disability need. So, you know, we are very much of the view that long term we must have a national disability insurance scheme. We're not going to deal with these broader funding issues for disability generally, and accommodation is such an important part of that. But in the shorter term, definitely more accommodation, but in a flexible way that reflects the needs of the individual with a disability. It might be more contribution from family members, and some families are in the situation to be able to do that, but they're not allowed to actually make that contribution under the current model. It might be different configurations, it might be more people together or less, it might be more clustering. So we need some innovation to try and address these issues so that we have a flexible approach that supports the individual with a disability and their families and carers in achieving these outcomes.
Well, while we're on disability, we've briefly mentioned the NDIS, the National Disability Insurance Scheme that's being proposed. Could you maybe just speak about coalition support for that, and you know what a Bailey government might do to help
Absolutely.
It come about?
Yeah. Well, Ted is very, very strong on the NDIS in terms of recognising that the system is broken and it's not going to be able to be fixed with more of the same of what we've got now. So what the Coalition has committed to is not a passive role but a proactive role in relation to achieving the outcomes of the NDIS. And I did hear the Premier say we've been very strong. In fact, the state government's submission to the NDIS had a lot of qualifiers in relation to the difficulty with its implementation, which I think the sector was very disappointed with the submission. And since they've reasserted their support, but in no way where Ted Bailey's taking it, which is we want to establish a secretariat in the Department of Premier and Cabinet in Victoria to drive the change, that we will commission research, that we will, when the interim draft report comes down from the Productivity Commission in February, that we will convene a meeting of ministers and we'll have done the work so we're ready to hit the ground running when we get those ideas of the Productivity Commission about where this needs to go. And when the final report comes down, where this needs to go. And when the final report comes down in the middle of the year, we're going to be very equipped to take that up. What families and carers and people with a disability don't need is a decision on this to go forward, but it takes another 10 years for it to be achieved. We need to be able to grapple with the very big issues that we will be facing through the recommendations, but be prepared to do that, ready to do that, and equipped to do that, so that a scheme can be implemented in as short a term of time as possible, and making sure we've got people at the table who can make that decision.
Thank you. Next service area. An increasing number of older Victorians living in their own homes for longer. This is Sandra Hill's CEO, Benetas, who's saying we're also witnessing an increasing number of older Victorians who are socially isolated. Now, the first part of the question is how will Bailey government tackle this issue, and can you outline a social inclusion policy specifically for older Victorians? And I'd probably add to that the fact that VCOSS has warmly welcomed one element of the current government's social inclusion policy for older Victorians in terms of their support for the regulations around new buildings and new dwellings that would come in a year or so. So how would you see a Bailey government tackling the issue of older Victorians becoming socially isolated, and a social inclusion policy specifically for older Victorians?
I think one of the challenges here out of this panel today, you don't have the Shadow Minister for ageing, so we're not as equipped over the detail in relation to that, other than to say that there is a strong recognition of the implications of social isolation for anyone, and particularly for older Victorians, and that addressing those issues can be so fundamental to well-being and health that it will be an integral part of what we need to make sure happens. There's some wonderful models that are happening in communities. In my own community, we have a group called the Women's Friendship Group, which regularly gets a couple of hundred women out together every month who wouldn't be from culturally and linguistically diverse backgrounds. And I think having mechanisms to support that sort of activity that is from within communities, grassroots to communities, people solving their own issues in relation to the needs that they have, will be a very positive part of what we will be doing, as well as sort of broader agendas to make sure, recognising this issue, make sure it is addressed.
Okay, thank you. Moving on in terms of themes, a number of the questions that came in for this discussion really relate for us to our approach around cause not consequence around violence in the community. And one of them from, for instance, Danny Blay from No to Violence talks about the significant focus by the Victorian government on the prevention of family violence and violence against women, but there's been a gross underestimate of the impact of spiralling demand for services. So it means that the bulk of Victoria's men's behaviour change programs are unable to cope with current demand, and in Melbourne's Northwest region, all 6 DHS-funded men's behaviour change programs are full. What would the Baillieu government do to greatly enhance the capacity of family violence organisations, both those that are around behaviour change, but also in terms of support for the victims of family violence, the women and children often are the victims, to greatly enhance the capacity of family violence organisations to respond to this increasing demand?
And another absolutely critical area, and can I say, family violence does sit under the women's portfolio, but in terms of a general response to that, and when we debated some of these measures in Parliament, once again, my own community, we don't have a men's behaviour change program, and it's been a big issue. In fact, there was one proposed, but it never got off the ground, which was very disappointing to everyone involved, because it's certainly very needed. We've been very supportive of the actions that have been taken in relation to family violence as such an important issue that underpins a lot of what ultimately happens for women and also for children growing up in those contexts, and the changes that are needed to be happening. I think we're very aware, and Louise Asher as the Shadow is very aware of the value of the work that men's behaviour change programs undertake, and will be very supportive to the future to make sure that they can continue to do the good work, and I think look seriously at how they can be expanded for future impact.
Okay. And the other service one relating, I suppose, to this question is those questions around alcohol and drug issues and treatment services. So there's a question here around just the extent to which a Baillieu government would increase treatment sector capacity to meet unmet demand and work with the alcohol and drug sector in addressing these issues.
And I've been working very closely with the alcohol and drug sector as well in relation to these issues. We're going to have a very comprehensive plan. We have a comprehensive plan in relation to drug and alcohol issues. We will be putting more money into treatment services, particularly recognising the lack of access for regional areas, for the growth areas. People wait on waiting lists, die on waiting lists for a huge amount of time, not being able to, when they've taken that proactive step to actually address their addiction, they then can't get the support that they needed. We'll also, though, have a broader approach, and this might tie into where we're going next, of how do we actually deal with the drug and alcohol issue more broadly? How do we take a preventative approach? How do we help young people make positive decisions in relation to their drinking? How do we limit the access to minors who shouldn't necessarily be drinking? And we know the younger people start drinking, the greater harm it causes over time, certainly both at the time and in later years. So we will have a broad alcohol and drug strategy that looks at how do we prevent young people from drinking at levels which cause harm. How do we make sure we deal with treatment and access services, and also how do we deal with the more difficult implications of alcohol-related crime and violence.
Yeah, which I guess brings us into our colleagues, VCOSS's colleagues working on the Smart Justice campaign, the Federation of Community Legal Centres. So what we're seeing is the overall crime rate per head of population has dropped by 30% since 2001. Knife crime has dropped, assaults with knives are down by 12%, robberies with knives down by 61% in the last 10 years. I think the VCOSS question, I suppose, adds on to that, which is when you look at how much it costs to lock people up in prison, and Productivity Commission figures show that it costs $886,000 to imprison one person for 10 years. whereas that same amount could offer drug and alcohol treatment to 295 people. Given that we've got such a high proportion of people currently in prison